Okay. What's our topic today?
Today we're talking about breast health and how to maintain or prevent, maintain the breast health or prevent breast cancer. And we're taking any questions that ladies might have about their breasts or the health of their breasts, and things about screening, things about activities that they could be engaged in to prevent themselves from developing breast cancer or reduce their risk. And we'll take any questions.
We also just posted a fantastic article about breast health that I read and said, hey, that's actually really good. So if you guys have a moment to go onto our website and under Chinn Chats and look up the recent article that we posted, it's pretty phenomenal and it's full of a ton of great information. So with that being said, we will kind of kick this off for you guys. And again, if you have any questions, please don't hesitate to jump on here and leave them for us. In regards to breast health, what is the number one thing you can recommend? We can even do the top 3 or top 5, but at least the number one thing you recommend for women to focus on when they are thinking about their breast health.
In terms of screening, detection, prevention?
I'm going to say prevention just because that's probably on everyone's forefront, especially during this month of October.
Yeah. So during this month, which is Breast Cancer Awareness Month, the month of October is designated nationally as Breast Cancer Awareness Month. We here are aware of breast cancer every month because we're screening for it and talking to people about their own individual risk profiles and how to prevent breast cancer or how to reduce their own individual risk. So we're thinking about breast cancer all the time. But the most important thing that a woman can do to decrease her likelihood of developing breast cancer and any other kind of cancer is quit smoking.
Oh, I wasn't expecting that one. I wasn't expecting that one.
Avoiding tobacco products of any kind, and in particular cigarettes, but we're learning a lot about the vaped tobacco, that it's actually just as bad, if not worse, than a cigarette. Because what's in the juice and how it's absorbed into people's bodies. Smoking is the worst thing that somebody can do in terms of increasing the risk of developing cancers of all kinds, including breast cancer. So women who smoke are much more likely to develop breast cancer and have difficulty recovering from or being treated for breast cancer. And they're much more likely to develop all cancers over time. But breast cancer is definitely linked to cigarette smoking. And for women who are postmenopausal, exposure to secondhand smoke as well increases their risk of developing postmenopausal breast cancer.
If any of you smoke and you need help with you quitting, give us a call because we can help. And I'm learning a lot of this too. So this is a lot of attention is focused around breast health, and there's never too much. We actually talked about this the other day about a very large stigma around when you go in for your annual, and some providers say you don't need a breast exam, you need to do your own breast exam, you don't need to do your own breast exam.
Yeah, it gets confusing.
A little bit, and a little scary.
So there are 6, maybe 7 national organizations that make guidelines for screening and prevention. And in particular, these organizations focus on screening and prevention of breast disease, mostly cancer. And those organizations, not one of them agrees with the other organization. So initially we had this, you need to do your own monthly self-breast exam, and you need to do it like this, and then you need to do it like this, and you need to do this, and you need to do this, and you need to do this. And we had those little plastic things that we hung in the showers, and just to remind us, like, we need to be checking, and nobody really knew what they were checking for. And what they found when they looked at, does doing that prevent breast cancer, was that it doesn't actually prevent breast cancer. It doesn't actually save lives. So the United States Preventive Services Task Force released an announcement saying people should not do that anymore. Because we're not saving lives when we do it, it's a useless endeavor. We're potentially causing harm because people get worried about something that's in their breast. Women get worried about something that's in their breast. They come into their provider, they're worried, there's nothing wrong, and so they shouldn't do it at all. Now, does that make sense though?
I mean, because we've had this conversation, I kind of understand. But for those of you out there who were not present for this conversation, it can get very, very confusing.
Yeah. So then women are like, sweet, I don't have to examine my breasts anymore. I didn't like doing it. I don't like the thing hanging in my shower. Like, it made me, I don't know what I'm
looking
doing.
for.
I forgot to do it and then I felt guilty about doing it. So whatever, I'm just not going to check them. That's not the best approach, because the woman is the person who's going to notice when something changes, but only if she's actually looking to see if something's changing. So what they now recommend is something called breast self-awareness. And breast self-awareness is just being super familiar with your own breasts. So we can't be super familiar with our own breasts unless we touch them, right? Like, how would you know if there was a lump in your breast if you weren't regularly touching your breast? And you're somebody who has menstrual cycles.
Unfortunately.
Your breasts are going to change during the course of the month because of different hormonal stimulation of the tissue. So you're going to find some things at the beginning of the month that are different from what you might find right before you have your period. And how would you know if that was a normal fluctuation for you unless you were regularly checking? Checking, being self-aware, means you should examine your own breasts. But we're not calling it breast exams anymore because the United States Preventive Services Task Force came out and said it's a waste of time, people shouldn't do it. So what that means is there's a whole bunch of women who are not examining their breasts anymore because they don't have those things hanging in the shower, we don't give them out anymore, and we don't tell people that they should be doing it. So everybody says, well, I'm just not supposed to, so I'm just not going to. My doctor told me it was a waste of time. Many providers are even telling women they don't need to have clinical breast exams. Nobody needs to be examining their breasts. And I don't believe that it's actually true that we won't save lives by doing those things. So I think if we look at a huge population of people, who look at 10,000 women who examine their breasts all the time, and we look at, well, you know, maybe of those women, the same number got breast cancer, the same number died of breast cancer, but maybe one woman found her breast cancer, went in and said, hey, there's something in here that wasn't always in here, got the provider to order the imaging, got the biopsy, got the diagnosis, and was treated and lived because of it. That one woman's not going to look statistically significant over that course of 10,000 women, but it matters for her and for everybody who loves her. So what I would recommend is that people continue to examine their breasts, and that I'm not worried about your female anxiety around your lumps that you find, because boobs are lumpy. You will find lumps in there. I would much rather a woman know that it's there, learn that it's normal and it stays there, or come in and say, I don't know if this is normal or not normal, and have a provider who knows what they're doing, right, because they know how to examine breasts, say this is normal or this isn't normal, and pick up that cancer. I would rather see 50 women who were worried and have nothing be wrong than have one woman say, I don't know, I guess I'm probably just anxious, or not find it because she's decided not to examine her breasts because she was confused about what she's supposed to be doing.
Right.
Does that answer your question?
Oh yeah. Oh yeah. And with that being said, there's this huge conversation, like we were just talking about, of some providers feel that they should do breast exams on you. Some providers feel that you don't need to. How would you recommend a woman advocating for herself when, because I'll be honest, I asked for a breast exam and my provider told me no, that you don't need to do that. And I kind of got this overwhelming sensation of, but then who's going to make sure I'm not missing something? How would you recommend myself or anyone advocating for themselves to kind of?
Right. So the same organization, the United States Preventive Services Task Force, came out and said, at the same time as they said, women, stop examining your breasts because it's a waste of your time and it's not saving lives, they came out and said, and providers, you might as well stop doing it too, because you're not saving lives. By doing breast exams, you're not finding anything that's significant, and we're maybe causing harm because we're causing people to have biopsies of things that are not cancer. So stop checking people's breasts because you're causing problems. I think the same argument applies, though, and I think, so the American College of Obstetricians and Gynecologists being people who are specially trained to take care of women who have boobs, they know how to do breast exams. That organization says, nah, keep doing it. Every year, keep checking your boobs. But I think that obstetricians and gynecologists are probably more likely to know the difference between something that's benign and that we're going to biopsy and cause harm by doing something that wasn't necessary versus something that's more concerning and is actually likely to be cancer. So I think that people who are specially trained to do breast exams and are very used to examining breasts are much more likely to have a useful breast exam, as opposed to somebody who's maybe an internal medicine doctor, doesn't feel super comfortable with it, is seeing a woman, feels like, well, I don't really need to do that because it doesn't make a difference anyway, and I'm not really sure when I examine breasts, like, is that a lump that matters? You know, if you see a provider who you've never seen before, and they've never touched your breast before, and you're not doing breast exams anymore because you think they're unnecessary because we told you don't touch them, it just makes you nervous, and then you're nervous and you come in all worried. Then we don't know what to do with you. But if you're seeing a provider who's never examined your breast before, how would they know if something's normal for you or not? Right. And if they're themselves not super comfortable with determining whether something's normal or not, then they might actually be doing harm because they'll be like, I don't know, I'll order some imaging, and then you end up with a biopsy that you maybe didn't need. But if you're seeing a provider who is familiar with breast exams and knows you, because hopefully you'll be seeing a consistent provider across time, then that breast exam is actually an incredibly useful tool because they know how to do breast exams and determine what's normal and what's not. And they know what's normal and what's not for you. They'll say, oh, yeah, that is different. And they'll be able to monitor it and make recommendations from there. Does that make sense?
Oh, yeah.
So the same thing I think applies. That this huge group of providers was doing breast exams, and among the 10,000 providers that they studied doing breast exams, maybe they didn't reduce the risk of cancer, maybe they didn't find statistically significant things, but the providers in that, because they didn't really break it down by the kind of provider who was doing a breast exam, just all providers doing breast exams, doesn't make a difference, stop doing it. They didn't break it down by, of the gynecologists doing breast exams, do they find things that are meaningful? There's no study that looked at that, and there's no study that looked at, of the people who found things that were meaningful, was it a consistent provider across time who was finding those things? You know what I mean?
Yeah.
So it's really hard to interpret those things, and I think that what we've jumped to as a healthcare entity, all healthcare entities have said, look, there are these guidelines saying women shouldn't examine their breasts, and we don't need to do it either, so just stop doing it. And that's what your provider was holding on to. There's a guideline that says I don't need to touch your breasts, and I'm not going to do it. And you're right, that's an uncomfortable thing, because if they're not doing it, who is?
Right. Well, I wasn't.
Right.
I mean, I
People
wasn't.
don't.
I'm a normal woman today, right?
Mm-hmm.
If your provider tells you you don't need to be doing it, then I think like, oh, like I'm being overcautious. Like maybe I shouldn't be doing it. But you should. You all should. Everybody should. And I mean, advocating for anyone else out there, if that's ever happened to you, like Morgan said, please call us, come in and see us. Like she said, she'd rather see 100 women a day monitoring their breast health than maybe missing that one who unfortunately has a maybe worse off diagnosis than any woman would want. So bring us your boobies. Bring them all to us. Mammograms.
Yes.
Mammograms. Oh, that mammograms. The
Yeah.
boob squisher. From what I understand, women should start them at the age of 40. Or not. What are some maybe family history things that women should be paying attention to that could prompt them to maybe get a mammogram before the age of 40?
Yeah. So I'm going to tell you something that's going to be surprising. Most breast cancer is not genetic.
You're not surprised, then I'm naive because I'm surprised.
Most breast cancer does not happen in women who have a family history of breast cancer. So a lot of times people think, oh, that's not in my family, so I don't need to worry about it. Most breast cancer is not genetic. Some breast cancer is genetic. So there are some breast cancers that family history is really important for. It is really important for every single woman to have an individual risk profile drawn up with a provider saying this is your likelihood of developing cancer, because it is different for you than it is for me, than it is for Dr. Chinn, than it is for any of the patients we've seen today or any of the patients we'll see tomorrow. And each person has an individual risk profile that is different and unique for them, and it's going to change next year. And it's going to change maybe in a week when they start smoking. And it's going to change based on things that they're exposed to, things that they do, things that are happening in their lives. If you get pregnant, your risk for breast cancer decreases.
That's the way
If
it
you
is.
breastfeed that baby, your risk for breast cancer decreases. So do you need the same mammogram as I do? And at the same time, no.
Right.
And there are things we look for in people's history. If they have a first-degree relative, that's your mom, your sister, your dad, because men can get breast cancer too, your brother, first-degree relative, somebody who on that little family tree that you drew in grade school would be directly connected to you.
I love her references sometimes.
Then you need to start mammograms earlier and maybe different kinds of imaging earlier. So a mammogram is not the end-all and be-all, right? Like, it's a screening tool. And one of the things that I went to a conference in March, and one of the things that a radiologist who images lots of breasts said was, well, gosh, like, mammograms aren't really that great because we're radiating people, right? So how many people do we have to radiate with an X-ray, which is what a mammogram is, of the breast every single year in order to pick up breast cancer? So we've said, as a guideline, as a universal guideline, stop doing breast exams, but keep doing the mammogram. Like, do the mammogram regularly. But the mammogram has more harm than the breast exam, potentially. So that doesn't make any sense. But the mammogram doesn't really make people super anxious, except when it comes back weird. And then it makes people very anxious, because a weird mammogram always in our minds means cancer. Always on Google means cancer. A weird mammogram is just as bad as an uncertain breast exam. So again, starting those mammograms, there are some organizations that say start them at age 40. And if you have a family history of first-degree relative breast cancer under the age of 50, start them 10 years prior to the diagnosis of that first-degree relative. But I would argue we should be doing ultrasound too, because it detects more things in younger women's breasts than the mammogram does, and it doesn't contain the radiation. So I'd argue we should do breast exams or breast ultrasounds as a screening tool, and not a mammogram on those women, without radiating them for another 10 years of their lives. And depending on your individual risk profile, you may decide to do it every year. You may decide to do it every couple of years. There's nothing magic about that 12-month period of time, right? Like, there's nothing magic that happens between October of 2019 and October of 2020, where you might not develop breast cancer in December of 2019. You know what I mean?
Yeah.
That is kind of an arbitrary screening metric, because we have to have some kind of rule for how we image things, but that we can apply to everybody, and mostly for insurance purposes, right? Like, if you go and get a mammogram today, and it's a screening mammogram, they're not going to pay for it until a full 12 months has elapsed. Not because that's the magic time, or we're any more likely to pick up your cancer next October than next June, but because that's the arbitrary time they've assigned, and they've said you are entitled to a mammogram, but only one per 12 months. So to answer your question, when should we start doing mammograms, is a question that's going to have a different answer for every single human being. And if you have a provider who says, you're 40, you need a mammogram, you should ask them, why do I need a mammogram? Why do you say that I need a mammogram? What is my individual risk? What is my likelihood of developing cancer over the course of my lifetime? And why do I need one every year? And if they don't know the answer, they're just applying a rule to you because they read it somewhere and they said every woman who turns 40 needs to have a mammogram. That's not necessarily the case. There are some organizations that say don't start screening breasts with mammograms until women turn 50. Well, then we're missing all of the potential cancer that we might have been picking up, which isn't a ton, but for you, if you have cancer, that's all the cancer you care about. And that's 10 years of cancer that might have been progressing in your body that could have been detected and treated. So do we start them at 30? Do we start them at 40? Do we start them at 50? How many years do we do them? How frequently do we do them? I think we don't have great guidelines as a health profession, even the medical providers don't really know what the true guideline is, and it has to be individualized. So we have to come up with a plan that's just about Sarah's boobs and just about Sarah's being, and takes into account that genetic history, remembering that most breast cancer is not genetic.
So if your provider is not, oh, sure, they do ultrasound. I'm going to answer that one question. I just wanted to point out, if your provider is not doing what she just explained, if your provider is not developing an individualized plan as far as how your breast health should go, start asking questions, start advocating for yourself, or call us and we'll do it for you. Sheree said, why don't they do ultrasound as routine screening instead of mammogram?
That is a great question. It's because mammograms have always been done.
Period.
It's because mammograms have always been done, and mammograms do detect breast cancer, and mammograms have been the screening modality that's been used for the longest amount of time on the largest number of boobs. So they've picked up the most breast cancer with mammograms, and so they say mammograms should be the standard. Also, because insurance rules how we receive health care, insurance says we'll pay for a mammogram, but we're not going to pay for an ultrasound. And is there more money tied up in getting an ultrasound? Potentially, because you have to have a tech who's trained to do the ultrasound and can do it appropriately, and then you have to have a radiologist who's been trained to interpret that breast ultrasound. Should it be done as the routine screening? There's an argument that it should be, because it carries with it zero risk. We're not increasing somebody's risk by performing an ultrasound on them. When we perform a mammogram, which is an x-ray, we use radiation to image those breasts, and the person is inherently exposed to radiation from that test. But no organization has made any kind of recommendation that routine ultrasound will be done. So if, for instance, you were to see me and say, listen, I don't want a mammogram, I want a breast ultrasound, I would happily order it. I would say, sure. I would order your breast MRI, because MRI, also no risk to the patient, way better. It is a way better test to detect breast cancer. MRI is done after your mammogram comes back bad. So why don't we just routinely screen everybody with MRI? That's an expensive test, and your insurance doesn't want to pay for it. So no insurance is going to pay for screening MRI because it costs a lot of money versus a mammogram. And ultrasound, probably about the same in terms of actual expense, but no insurance company is going to authorize it. So say you come and see me, I'll say, yeah, I agree. I think it's a better test. I agree with you. We should do that test instead. I'll write the order. I'll send it over to the folks who do the imaging, and then your insurance company will say, nope, because the rule is a mammogram. Does it make sense? No, not at all. It doesn't make any sense. But unless the woman then says, I'm going to pay out of pocket to have that better test done, she's kind of at the whim of her insurance. And the insurance rule for decades has said mammograms are for breast cancer screening. So when they see, and it's the person who assigns the benefits maybe doesn't even know what a mammogram is. They know a mammogram is for boobs, and they'll read their sheet that says, this person's allowed to have a mammogram, and then they'll see ultrasounds only indicated if their mammogram's abnormal, or for these qualifying criteria, and then they'll just deny it, and they'll send it back to me and say, nope, doesn't fit our rules, she can't have an ultrasound done. That's really the only reason why we don't do routine ultrasound screening. So in order to change the way that something's always been done in the healthcare system, you have to show that you're saving money for the insurers, and you have to show that it's equivalent. And right now, most women have not been screened with breast ultrasound. They've not done enough rigorous trials with enough numbers of women to show that an ultrasound is equivalent to a mammogram. Mammograms have been done for decades as the routine screening modality, so we just keep doing it. And that's not a good answer. That's a terrible answer, but that's the answer.
That's the truth. And I know we're running out of time here just for this Facebook Live. So I've been thinking this whole time, you know, when is the most appropriate time to do your own self breast exams? Because I know there's some contradictions there of, you know, the week before your period, while you're on your period, the week after your period, all these.
Yeah, I think whenever you think of it, you should do it.
So if a woman's doing it 17 times a month, that's okay.
I mean, they're her moves.
I mean, that I agree.
She puts them in her shirt every day. She walks around with them on her body. Is there a perfect time to do a breast exam? No. The perfect time to do the breast exam is when you think about doing it. So we gave people those placards and said, do it in the shower, because the boobs are there and there's no shirt on, and you might think of it and do it in the shower while you're in there, and then there's something to prompt you to think of it. But is there a particular time that you should be checking them? No. The reason that they say do it the week of your period is because you have the least hormonal glandular stimulation. This is not true if you're on any form of hormonal contraception. So that changes it. If you're on hormonal contraception, if you're taking hormone replacement therapy, if you're breastfeeding, this is not true. So there's not a time when it's better to check your boobs. Now, you're going to have the least hormonal stimulation of your breasts when you're actively bleeding. So when you're having blood come out of your vagina, if you're not on any kind of hormones that you're taking, and if you're not breastfeeding, then you should examine your breasts then, because they'll be less dense. You'll be able to tell the glandular tissue is not going to be as stimulated. You'll be able to tell, like, oh, that's a lump versus like a little cyst that's formed in your breast. However, what would happen if you didn't examine them then and examine them another time during the month? You would just find lumpier things. And then if you're regularly checking your breasts, you'll notice, like, oh, those are there right before I start to bleed, and then I start to bleed and they go away. So is there something magic about once a month breast exams? Not any more than there's something magic about once every 12 months having imaging done. So I say the perfect time to do a breast exam is when you think about doing a breast exam. And is there a way like this, or like this, or like this, or like this? Is there some like special technique that you have to learn or be taught, or do you have to go to school or get a certification for this? No, they're your boobs. Just be familiar with them, touch them, look at them, know when something's changed. If your skin looks funny and it didn't before, you're the person who sees your skin the most. Come in and say, look, that is different and it wasn't there before, because we're so obsessed with finding lumps that we forget that a lot of breast cancer doesn't start as a lump. A lot of breast cancer starts as a visual change that you can see in the skin, or the texture of the skin, or the feeling of the skin, and there's no lump anywhere because the lump hasn't formed yet. By the time you find a lump, there's a problem.
Take note of that. It's not just about a lump. If your skin looks different,
or if there's a weird feeling, like if one of them just feels funny and it's not right, and it doesn't always feel like that. Like everybody's boobs feel weird before they get their period, but if yours is just all of a sudden feeling different, and it's just one side, and it feels in a way that you can't describe, or there's something that doesn't feel right, that's just as important as finding a lump. And we're so obsessed with lumps in these lumpy things that's mostly why I think we've decided as a medical field we're not going to deal with these lumps anymore, because everybody has lumps and none of them matter. That's not true, but it's also not the only thing we should be looking for when we're being aware of our breasts.
So 3 things with that I've been kind of thinking as you were talking about these things. 1, feel your boobs. Feel your boobs, know your boobs. Know that we're not just looking for lumps. 2, I feel like this is that cliche thing, but if you see something, say something. And 3, if you are sitting here right now not feeling your boobs, start feeling them. I feel like I should be feeling my boobs right now because we're talking about it and thinking about it, and I should be doing it more often. And it's almost reassuring to know, like, it's okay if you do it more than once a month. It's okay if you don't do it at the same time every month. Like, if there is no standard of when you should be examining your breasts all the time.
Yeah, and I feel like one of the things that has happened with the recommendations for breast cancer screening and breast cancer detection and breast awareness, and the recommendations that have shifted around breast exams and whether anybody should be doing them, I feel like one of the things that has happened is sort of this historical notion that women get hysterical, right? Like, that's where the word hysterectomy comes from. You take the hysteria out of the woman, because for the longest time the medical community thought the uterus makes the woman crazy. Like, it makes her crazy. And so I think a lot of what is actually behind the changes in the guidelines is, look, you're worried, sweetie. You're worried, and it's a waste of my time. And I hate to say that because it sounds terrible, but I think that that's actually providers and groups of health systems decided we're seeing all these women for things that are worrying them, that are a waste of time. We're not finding cancer. We're not doing anything. They should just stop coming in. And so in order to get them to stop coming in, they should just stop doing these exams. Tell them not to do it because it is a waste of our time. It is never a waste of time to have something normal happening and know that it's normal.
Right.
It is never a waste of time to wonder if something is normal or not normal and have us potentially pick up something that's not normal or reassure you that actually that's normal.
Right.
So continue to monitor it. And it is never a waste of time for you to come in and have me educate you about your breasts and what you should be doing with them and what you should be worried about and ways to look at them. Might be a waste of your insurance company's money.
Bummer.
But that's another conversation.
So prevention is key. Prevention is key.
Prevention.
Feel your boobs all the time.
And they're your boobs.
Feel your boobs.
You're the person who's going to know best when something changes. Because even if you come in to see me, even if you came in, maybe you come in every month and then I would get to know your breasts really, really well if I did an exam every month, but that's kind of pervy. So let's say you see me once a year and I do your breast exam at your annual exam. I'm still not going to know because I'm going to examine so many breasts in between. I'm still not going to necessarily know as well as you do. If you're super aware of your own breasts, I'm not going to be the person who probably picks something up. It's going to be you, and it's going to be you coming in and saying, I found this. Well, what's going on?
Right.
And then I'll be able to say, yeah, that is weird. You'll be able to point to right where it is. It's right there. It hasn't been there. And then we'll be able to really direct things. So it's really the woman should feel her own breasts. She should do her own exams. She should advocate for herself. She should be aware when something changes because she's the person who's most likely to pick something up and tell the provider there's something going on.
And so many women nowadays use the menstrual calendars on their phones, right? And thinking, well, I track my period. I should probably start tracking when I'm doing my breast exams. That way, maybe I felt something before my period, and then after my period, I feel again, and I'll, I can mark that it's not there anymore, or over months of time, that's still there, that's getting bigger, that's getting
changing.
It's getting hard, like my skin's changing.
There's something else happening with it.
Yeah, and really just keeping track of. I mean, I'm already on the app to track my period. I'm worried about my Fitbit and all the steps I'm taking. I should probably start tracking my breast exams.
So I'm going to go against all of the guidelines that say don't do it, and I'm going to say do it, and do be aware of it, and do say for yourself to your provider, hey, there's something going on, and do demand, like you did, hey, I want the breast exam. And if you're not the person who wants to do the breast exam because you don't feel confident in your exam, I would like a referral to somebody who can do a breast exam and who will know if something's problematic or not.
Yeah, absolutely.
Because it's not a waste of time.
No, definitely not. Definitely not. So advocate. Can a lump that was benign turn cancerous?
Yes. Yes, it can, which is why we shouldn't be ignoring those things. So if you have a lump in your breast and the lump gets evaluated and it was benign, if you have what's called a fibroadenoma in your breast, which is just, it's a firm thing, it's not cancerous, you have the cells biopsied, none of those cells are cancerous, that actually still increases your risk for breast cancer. And part of the reason that it increases your risk for breast cancer is, first of all, you have a cluster of cells that's very tightly knit inside a particular part of your breast, and those cells are being stimulated differently from the ones that are spread out across your breast, and those cells could potentially develop into cancer, or they could cause inflammation in the rest of your breast. Inflammation causes agitation in cells. Anything that's inflamed is more susceptible to a change that could become malignant. So a lot of times we're like, it was benign, don't worry about it. Still want to monitor it, and it does change that individual risk profile in terms of your personal risk for breast cancer. So a lot of times people will be like, you have dense breasts, there's a lot of lumpy stuff in there, yeah, it's probably all benign, it's not a big deal. But that woman with dense breasts who has a lot of lumps has a different breast cancer risk profile than somebody who doesn't have a lot of lumps. And if she has dense breasts, she really does need different imaging than a mammogram, because a mammogram is not the best modality. Then your insurance company, if we put the right numbers and the right letters and the right periods on there, your insurance company may pay for you to have an ultrasound as opposed to a screening mammogram, because we've said your clinical condition is different. You have a higher risk of developing breast cancer because you have dense breast tissue, or the mammogram is not going to pick it up, so it's kind of a waste of time to do that. But yeah, if you have benign lumps, those lumps should be monitored in an ongoing fashion, because those lumps do put you at greater risk of developing cancer. Which doesn't mean all lumps are going to become cancer. Most lumps are not. Most lumps are benign or non-cancerous. But if you've had a benign condition diagnosed, it does increase your individual profile as far as your risk for breast cancer.
I think this is all fantastic, and I know I could talk about this for quite some time.
We have patients to see.
We do have patients to see, and I want to leave you guys with just a couple of things. One, if you watch this and you have questions about anything, you can comment them on this video. You can give us a call, email our website or our email address on the website. I mean, find a way to get in touch with us, and we would love to answer them. And then two, in honor of Breast Cancer Month, though this is going to be ongoing, but in company with Breast Cancer Awareness Month, if anyone had not seen our post about mastectomy, scar removal,
It doesn't have to be a mastectomy. Any breast cancer survivor who's had something done to her breasts for any reason, because some women have breast cancer and they don't have a mastectomy. They get to keep their breast, but they have a large portion of it removed, or they've had reconstruction, and so they do have breasts, or they've had a partial something done. Anybody who is a breast cancer survivor who has a scar that they would rather not have, we will take care of that scar for you.
Complimentary. So call us. It's hard enough as it is, so please let us help you make something a little less difficult. Call us, schedule an appointment, touch your boobs, enjoy your weekend, enjoy the rain.
Bye.
Bye, guys.